Hello everyone and welcome back to Humble Heart Horsemanship. So today's video is a little bit different. I basically just came down to feed the horses and we have an emergency with one of my boarder's horses. His name is Slide and he is this really sweet, very big Palomino senior gelding. And I fed my horse Gunner. I was going down to let Slide and Gemini out into the big pasture because that's our summer routine. And I just looked at Slide and noticed that his right side of his cheek on his face was so swollen. It was about 3 times the size of his left cheek. And so I want to talk a little bit today about how you would usually handle finding a horse with a swollen cheek and just some good tips and things to think about if you're ever in that situation. So first thing I want to point out is that it is vital that you are checking your horse's overall body condition whenever you can, whenever you're around them. So I know a lot of us get into the habit of trying to do our barn chores and our chores with our horses very fast, and we kind of get into like our own synced rhythm with that, and some of us are really good about doing it fast. But sometimes when you do things fast, you're going to forget some really important things, like looking at your horse's body all over. It only takes 30 seconds or a minute or so, and you want to do this because you want to check to see if there's any swelling or any injuries or really anything going on with your horse. If we're too fast to just get our horse out of pasture, put him away for the night or for the day, we can miss out on finding sometimes very serious things that we may have missed. So that's my first tip. Anytime that I'm around my horses, when I'm filling a trough or bringing them in from pasture, I'm always just checking to see what's going on with them. You can catch things before they get worse. So I actually was about to put Slide's fly mask on when I noticed that the right side of his cheek was really swollen. And so if you find a horse with a swollen cheek, it can be numerous things, but most of the time, not always, it is that a horse has an infected tooth or an abscess tooth or a cyst there. And what can happen is, like if you think about any other type of infection or abscess or a cyst, if maybe you've ever had one before, it's going to cause a lot of swelling and a lot of pressure, and that can cause a lot of pain for the horse. So once I found that, I was looking at Slide's face to check to see if he had any puncture wounds or any cuts on his face that may have caused that. So I was really assessing him once again, and I didn't find anything. So it tells me that what's happening is internally happening in the horse's body. It wasn't really probably caused from something externally. So that's a good thing to do. That swollen cheek, you want to hold back from feeding your horse, because if you think about having a super swollen cheek, it would make chewing and overall digesting your food really difficult, and the same is for the horse. So I didn't want to just feed him like usual, so I held all feed back. And another thing I did is I looked at the rest of his body, and I was basically checking his other vital signs. So the first thing I'm looking at were his eyes to see if they were bright or if they were dull, because that kind of tell me more. And then I also did a skin pinch test for dehydration, where I just take my fingers on his neck, pinch some skin, hold it there for a second or two, and then let it go. And this is a good way to check for dehydration. So if your horse's skin flap that you're holding returns back to normal really fast, that tells you that the horse is probably not really dehydrated. And if that flap of skin returns back really slowly to the horse's skin to become flat, it can tell you that the horse may be dehydrated. And then you can also check your horse's temperature and kind of see what's going on there. So that just gives you more information about what's going on and can also tell you how severe this injury is to the horse. So I did all of those things. He didn't seem like he was dehydrated. His eyes looked bright. He was acting pretty normal and still wanted to go out to pasture. So you can also check to see if your horse is acting just normal in behavior. So, if they're always excited about eating, which most horses are, and the horse is not that excited when they see you coming down, that could tell you a little bit more about how the horse is feeling. So that's really good. Next thing is, because this horse is not mine, what I did is I took my phone and I just took a few pictures to show the swelling, and I also took a video of his swelling and sent it to his owner. And I tried calling her as well, but she didn't answer. So I'm just kind of waiting here for her to call me back. And I basically just gave her an overall picture of what's going on with Slide, those pictures, and I also told her that he definitely needs to be seen by a vet. Now the swelling is really a lot, and you'll see that in the clips that I'll be showing throughout the video. This leads me to another point. This is why it is so important to keep your horses up to date on their teeth floats. If you don't know what a teeth float is, it is basically where you have your vet or some type of equine dentistry specialist come in and use an electric tool to file down the sharp points in the horse's mouth. And horses' teeth continually grow throughout their entire lifetime. And what can happen if you don't float their teeth is inside their teeth develop very sharp points that can rub against their gums and just the side of their mouth and make it very uncomfortable and painful for them, and also difficult to eat, do things like carry a bit in their mouth, and just make them kind of crabby because they're in pain. So at least once a year you should have a vet examine your horse's mouth to check to see if they need their teeth floated. And some horses can wait a little bit longer than every year. Like my gelding Gunner, I was able at least a few times with him wait at least a year and a half, but it's important that I did have my vet do a thorough examination of his teeth. And a lot of vets will just, if they're not as experienced or not as thorough, they'll just simply pull your horse's lips apart, look in there and be like, oh, he's good to go for another year. But that's not what you want to allow to have happen. You want to have your vet sedate the horse, fully look in the horse's mouth, because horses' mouths are very deep and there's a lot going on in there that you can't see if you just do this. So you want to make sure that they're doing a very thorough examination and fully looking in the back of the horse's mouth to assess if they need that teeth float. I'll be keeping you guys posted, and hopefully his owner will get back to me soon and we'll figure out what's going on with poor Slide. And he just looks so sad out there in the pasture. He's like, I want to go out and graze, but I'm not going to let him right now. It's been about an hour and his owner did text me back. She said that she wasn't feeling very well today, so not so great timing. Going back to that rule I was telling you guys about, that horses usually find a way to injure themselves during already chaotic, already stressful times. But I have his food right here, and I made him some super soaked alfalfa pellets, and she wants me to feed him still, so we're gonna see how he handles some food. Just gave him his alfalfa pellets, and he seems to be able to eat it okay so far. He's eating it, kind of slow, because I can tell there's some pain and discomfort there, but he is trying to eat, so that's a good sign. Kind of shows that he's not in too much pain. If they are in a lot of pain, usually don't want to eat at all, especially in their mouth. Take little bites, buddy. And the alfalfa pellets are super soaked with water, so really loose, almost like a soup for him. Poor boy. Slide. Poor guy. He's such a sweet horse. He really is sweet. He was so confused this morning when I wouldn't feed him. He was like, what is happening? Gemini over here is wondering why he doesn't get any special alfalfa pellets. You don't get any because you don't have a swollen mouth, which is a good thing, huh? He's like, but I still want some, Mom. Slide is right behind me, you guys. It's about 5 or 6 hours later. Basically, what happened was his owner tried to contact the vet. She wasn't able to get into contact with him, and so she left him another voicemail explaining, and then she also talked to a very experienced vet tech who basically told her that it's a good sign that he still wants to eat, and it basically tells us that he's not in like so much pain that he doesn't want to eat, so that's a good sign. And also that it's not like an emergency, because it can wait a little bit, but we do definitely want to get a vet out here. So that's what we learned so far. And look at this sweet boy. This is my first time seeing what his cheek looks like, and it's still pretty swollen. His owner came out and said that it does look a little bit more swollen than the pictures I sent her this morning, but we're gonna still feed him and make sure he has some food in his stomach. I also am going to take a few ice packs and try to hold it up to his face, maybe while he's eating out of his hay bag for dinner, because the ice is really going to help with the swelling. And I don't remember when or where, but I remember at some point in my horse experience, someone I knew doing that with their horse when they had a swollen cheek, and it really helped. Be asking yourself right now, that's really weird that like she can't get into contact with a vet. But let me tell you, if you grew up in a city or any type of a metropolitan area, you're probably used to, like me, just having a vet that is on call, at least 1 or 2 vets or maybe more, or some type of equine hospital that you can call and, you know, talk to a vet and at least figure out kind of what's going on with your horse. But out here in Wyoming, it's the Wild West. It's very different. So I had a similar experience when Gunner colicked a few months ago, and I had called a ton of equine vets in the area, and only one of them was on call after hours, and they were out on a ranch call, and took about, oh gosh, they took about maybe like an hour and a half to get back to me about my horse colicking. So it's a very, very different territory out here, and you don't always have vets at your fingertips all the time. So that's why it's important to be as educated as you can be. So if something does happen, you're at least somewhat experienced and kind of prepared to handle it on your own. But that's what's going on here. So let's hopefully get him some relief with some ice. Slidey boy. Look at this sweet boy. Oh my gosh, his cheek is so swollen, you guys. Okay, well, we're gonna figure this out. Ice packing Slide's cheek right now. Gunner wants some attention too. But he's actually doing really well, staying super calm while I'm ice packing him. Gunner, stop messing with him. He doesn't feel good. I think this is gonna help bring down the swelling though, at least a little bit, and kind of help with some pain relief right now. But tomorrow we're definitely gonna get this figured out for him.